it has really, arose something in me to go into that field. Thank you so much.
Oh, that's great to hear.
I have one question for you. I think you've already spoken about that. If you can, elaborate briefly on the stages and then the grades of breast cancer, because a lot of people would like to know these, stages and grades of breast cancer.
Stages and grades, is it? Yeah.
Yeah, and then the next follow-up question is, if you, it is known recently there is a research going on of how quantum physics can help heal the body, given the appropriate conditions. So, like in the area of meditation, mindfulness, and etc. So, I don't know whether in your practice you have come across patients with cancer who have been healed. By means of quantum physics. Meditation and all.
Yeah, the complementary. Yeah, absolutely holistic. That's what we call it, as holistic. Outside the conventional treatment, isn't it? Yeah. Thank you. You're Anthony, aren't you? So thank you. So I'll do these 3 questions one by one quickly. The stages, of course, there are 4 stages in breast cancer. Stage 1 is localized. It's got tumor, node, and metastasis, TNM. Those are the 3 buzzwords. We need to know the size of the tumor. We need to know the nodes, whether the node is positive, whether it's spread to the lymph nodes or not, how many new lymph nodes. Again, there is N1, N2, N3, depending upon the numbers and the site, in the anatomical sites of the lymph nodes. And there is a metastatic M stage. M0 is not, it's not spread. M1A or M1B. There are, again, these are the TNM staging. Again, T1 to T4, once again, you've got tumor less than 1 centimeter, 1 to 2 centimeters, greater than 2 centimeters, more than 4 and above, involving the skin or involving the chest wall. You got inflammatory breast cancer. So depending upon, then you got 4A, 4B, 4C in the T. So it is quite in-depth, detailed staging for breast cancer, to be honest. So these are the TNM, and then based on the different combinations and permutations, you stage 1, 2, 3, 4. Stage 1, stage 2, 3, 4. So stage 1 is T1 N0 M0 or T2 N0 M0, where there is not spread to the lymph nodes, but it is 1 to 2 centimeters. Are you with me? So that's stage 1. That means stage 1 you can operate. You don't need any other upfront treatment. Having said that, it's also the biology, the ER, PR, HER2 status. It is multi-modality to make a decision, even for stage 1. If it is 10 centimeters, so 1 centimeter and above, but it's triple negative and grade 3, the surgeon would ask, can you give some chemotherapy? Because it's a behavior, it's a naughty one. So can you mop up everything, and then I'll do surgery. So the staging, the biology, all the receptors, and the grade. If it is grade 3 or grade 2, so there are 3 grades. So 1, 2, and 3. 1 is a slow growing, and the grade 2 is intermediate, and the grade 3 is the fast growing of the cancer cells. How it multiplies quickly. So that's the grade. So if it is a grade 1, T1, N0, M0, 10 millimeters, 1 centimeter, ER positive, PR positive, HER2 negative. This is the best good one I wanted to have. If I want to have a breast cancer, this is what I want to have.
Actually, when I was learning this stuff, it was quite difficult. But I think you find it very easy to explain this stuff. And thank you so much. Thank you so much.
Okay, thank you. And I think it's important, and everybody is busy in their clinical work. When you go for a consultation, there's so much to talk about these things. Even for one thing, there's so many things to talk about. So you don't find time to talk about the mindfulness and other things, the complementary therapy. But my practice, it's my own, my personal. I always feel that, if you want to have a successful, long-term positive outcome, conventional treatment alone, it won't work. You need to prepare everybody to face it positive. Any stress hormone, anything stress will affect your own immune system. Everybody has your own innate immunity to fight the cancer or fight any foreign bodies that comes to you. Your body can fight it out. So you need to empower your own immune system by staying positive, by doing what you like to do, by stop worrying. And this is very important. So you need to keep stressing, because your mind always goes back to that. It's easy to fall back, isn't it? You need to have that positive attitude. So being a musician myself, it's helping me to see. And I used to tell my patients, I have my own charity work. This is something I started. We have a charity card. I tell my patients, when you're on chemotherapy, radiotherapy, do something, handwork, or do something and bring it on and give it to others. By giving to others, you will feel good. The karma comes back. If you do positive, the positive comes back to you. So, yeah. So do that. And then what I'm collecting all this money to try and build a holistic platform in my center. I mean, and I can do that locally. So that's what I'm doing. And I also provide some nice music to them to link in, to have that rapport and to get that cleansing chatter of the mind away. It is very important. And you could see that in the long run, people do say that, yeah, I feel good. That's good that you're doing that. I do know that somebody is looking after me all the time. That support, that rapport and support is very important, because this is a chronic disease. It's going to be there for the rest of your life, but this is important, that confidence, that rapport, that you are always there and somebody is there for you whenever needed. And that relationship is very important for a long run.